Good afternoon, and thank you all for joining us for this seminar that we organize once every quarter from the Youth Resilience Unit. For those of you joining us for the first time, we organize these about 4 times a year, and these are all topics relating to development of emotional resilience, which is what we do in the Youth Resilience Unit, which is part of the Wolfson Institute of Queen Mary University of London. We're generally interested in looking at the different factors, risk factors and protective factors in children's mental health and well-being development. And we have speakers from lots of different institutes discussing their research. And today we are joined by 2 speakers. One is going to join as a recording because she couldn't make it at the moment, and they're going to share some findings with us about the Restart program, which is looking at school-based emotional burden and its links to mental health in autistic and ADHD students. We will first have Steve and Georgia give the talk, and then we'll take questions at the very end.
Sure. Thanks so much, Julia. Hi, everyone. I'm one of the researchers in the Restart research program, which stands for Regulating Emotions, Strengthening Adolescent Resilience. I guess for today's topic, we're going to focus on more on the risk factor rather than protective factor, a new construct that we call the emotional burden. And yeah, our program is one of the 7 UKRI funded research program, received altogether 35 million investments in the Adolescents Mental Health and Developing Mind initiative. Georgia, who's presenting with me, will appear to you in a virtual form because she is not available at the moment, but Georgia will start the presentation, and then I will join in the middle, and then she will present the last part of the talk. So let's start.
Talking about a project that is very close to my heart, Restart. Restart is a project led by King's University. Edmund Sonuka-Bark, Professor Edmund Sonuka-Bark is the chief of this whole adventure in co-production, understanding young people's emotions, understanding how we can improve school life and cutting down the risk of depression. So today, myself, Dr. Georgia Pavlopoulou, and Dr. Steve Lukito, who is live with you and is gonna start in a while presenting work. We will be presenting you parts of Restart with an emphasis on school-based emotional burden and its relationship with mental health in autistic and ADHD students. Please sit comfortably, get a cup of tea if you can, and enjoy the presentation. My emotions and me. Much of what we have been trying to do at Restart is to understand emotions, particularly neurodivergent people's emotions, from a youth perspective. All these accounts that are linking emotion regulation, emotion dysregulation with autism and ADHD are so very often based on external, adult-led concepts. And very often, these observations typically assume a deficit lens. So not only we're using vocabulary and frameworks and concepts that we have borrowed from adult mental health, but also when it comes to neurodiversity, we are very strong sometimes into deficit stuff. Meaning that a person is struggling because they don't have language to express their emotions, because they don't have good executive function, because they don't reappraise their emotions, and so on. It has been very important to make progress in research and contextualize emotions and emotional responses and get information from young people themselves, particularly neurodivergent young people who are very often asked to operate in a non-autistic, non-ADHD led environment. So in Restart, academic researchers and youth co-researchers work together in order to understand what can be upsetting and dysregulating for these young people in the school environment and how we can find solutions. Also because we want to cut down and understand the links and also cut down the risk for depression and anxiety in this population. So, in order to achieve that, we wanted to do things differently. We wanted to center the lived experience of the young people and engage with that authentically, which means we often call it an experience-sensitive approach, which means that we wanted to understand from themselves how they understand emotions, what do they do to prevent upsetting experiences, how do they manage upsetting experiences, and how they experience different environments and different emotions in different environments. Now, to achieve that, to achieve an authentically experience-sensitive approach, it means that we need to give lots of different media to people to express themselves. In our case, we created video vignettes. We asked people to create Lego and clay modeling, to dance, to record poems, to record their own voices, to write, to talk to us. We gave them in advance the tasks and the questions so they have time to process. So we tried everything we did to have a universal, neuro-inclusive and affirming kind of methodology so that they feel they can contribute. The findings I'm going to be presenting today are based on one of the Restart publications, interviewing 57 autistic, ADHD and OADHD, people with dual diagnosis, who are all adolescents, 11 to 15 years old, attending mainstream schools across England. The paper is open access, and maybe one of my colleagues here can also put it on the chat for you to access it and read it in your own time. So when we asked people what contributes to their dysregulation, and again, that's not the kind of word that they would use, people would tell us understand dysregulation as very big negative emotions that when they experiencing them, they feel negative about the world and themselves, they cry, they hit, they kick off, and so on. We had more than 600 quotes that spoke about social dislocation, alienation, and conflict. It was pretty heartbreaking, actually, to hear that. And it was heartbreaking to hear that this is mostly happening in the schools. Now, of course, that's not a critique on you, on the schools, or on anyone. It's just a reality, a very hard reality that we need to engage. And I'm hoping that you can approach today's presentation with curiosity and see how what you will be learning today can confirm and validate some of the things you're doing already well, or open new perspectives for you to connect even deeper and even more empathetically with the people you work with. So many young people told us that they feel alone, that they feel social unease during interactions, as well as when they are excluded from interactions that they really desire and they really wish they were part of. And when that happens, they feel lots of negative emotions about themselves. They lose hope into themselves. They lose hope about the future. And they believe that nothing can change. An ongoing experience of not being accepted and not feeling that you can belong, that others like you, is key to that. So very often people feel that others are talking about them but not with them. When it comes to autistic people, very often they talk to us about the stigma attached to the autism label, if you like it. They don't have a problem. They want to know that they're autistic. They want to be diagnosed. However, they have a problem with how others interpret autism. And paradoxically, getting too much attention as well can also make them feel unsafe, and very often people are seeing them just as autistic people who have a good or a bad day, and not as who they are and what they might be needing. When it comes to the ADHD people, so very often they said that they find themselves at school to be engaged in unsafe and provoking interactions, that people provoke them too much, that people don't understand them, that people very often make fun of them. And when it comes to those with a dual diagnosis, they spoke about experiencing really high levels of conflict, particularly with school authorities. So autistic people spoke more about stigma and isolation, which, don't get me wrong, unfortunately was the case for ADHD people. But ADHD folks brought that kind of issue as well, that even when they are happy, even when they are excited, this can be difficult for them because it might be interpreted from others that they are too much, that they are out of order. They feel that others don't tolerate them even when they experience a positive emotion, and that can also be eventually an upsetting experience and makes them feel sad. You can see a sample here of young people's artwork and some quotes. This particular piece of artwork is really touching me because it's named The Complex, and that's a kind of word, complex, that I have used as well in my reports in the past, or to describe someone who has multi-layered, lots of issues, lots of things happening and going on. And this young person has been saying about the devastating effect of being called complex in their family, in their school, and you can see they feel like a puppet. They feel like somebody who needs to be less complex for the others, and somebody who is constantly observed by therapists, by teacher, by parents about their behavior. Second most common theme, the experience of hiding one's true self. So young people felt that they have no other choice but to hide who they are, to mask. And that comes with a very high price for them to pay, because suppression of a whole range of emotions might look okay to teachers and parents, might look like, okay, they're regulated. But in fact, it means that they have to hide all of their natural feelings and preferences and reactions, and they can do that very well for a very long time until they cannot do it. And this is when they explode. Imagine it as the Coca-Cola effect, where you hold all that fizz, and then psh, it all expands in all sorts of ugly ways. So very often young people, they feel pressure to behave, to be perceived as in one specific way from others, because they are very worried that they will be misunderstood, and that is going to lead to even more loneliness and alienation, and they will be further excluded. So as they try to do that, they're also trying to protect, particularly the autism group, to protect others from their feelings, because they are very conscious that others might already be worrying about them, and they don't want to attract this kind of attention. They also don't want to make others worry about them. That kind of breaks the stereotype, I hope, that sometimes we do have about autistic people, that they don't empathize or they are not aware of other people's emotions. That was definitely not the case in our participants. Those with ADHD or dual diagnosis, they also want to protect others from the intensity of their emotions, but also ADHD people have been very practical about it. They just cannot take one more complaint. They're hiding who they are, they're hiding their emotions, because they want to protect themselves from other people's reactions, which in most cases have to do with punishment. And when it comes to people with dual diagnosis, very often they reported feelings of guilt and confusion. Now, how do all these relate to emotional regulation? A deep sense of caring about others, of hiding yourself, of worrying about being in trouble, also means that after a while you can't take it anymore and you are exploding. And people described how they can be very angry, they can self-harm, they can attack to others, and so on. I'll leave you some space to see the drawing and read some quotes. Last but not least, people spoke about internalized self-doubt, loathing, and embarrassment. They spoke about the fact that it's not myself having negative thoughts or catastrophizing thoughts. All these thoughts have a real strong logic basis on the basis of the context that I'm living with. These thoughts are justified, young people are telling us. because of the fact that it's very hard for them to keep up with neurotypical expectations. On every single moment, sometimes in a school environment, they are reminded that they're different. They are reminded that they need more help. They are reminded that they're not enough, that they have to try more. And this was very much, as an upsetting experience, this was very much related to sadness, apathy, anger, shutting down, or having a severe meltdown. And as I said, they kept on telling us that it's not about the way I think, it's the way I am taught to believe, because you guys constantly tell me I'm not enough. And that confirms then my experience of low self and my thoughts about low self-worth. That was very much related with feelings of being over-worried, catastrophizing, having severe self-doubts, withdrawing from different activities, and so on. Now, I'm going to give space to my fantastic colleague, Steve Lukito, to tell you how we took these results and we took on board everything that the young people have said to understand in more depth emotional burden, to test it cross-sectionally, and to create a new fantastic tool.
So you heard from Georgia about the different experiences that the young people expressed to us during the interview. So based on these preliminary themes of the young people experiences, and this was a while back, we created 2 questionnaires to help assess those experiences in a larger scale. And this is really important because we want to make sure that we tap into the experiences of many students to gather some evidence and to get some representativeness of the experience. So the first of these is called My Emotions in School, or MESSI, My Emotions in School Inventory, sorry. The MESSI focuses on 25 school-based commonly upsetting events. We call it cues here for short. Each event produces what we call emotional burden, and this is due to how frequent it happens to the young person and how much upset it causes each time. We then multiply, so the total score is emotional burden is a multiplication of these frequency and intensity summed over the number of cues and is create a score that we call the emotional burden index. So in a sense, it's combining the triggering environmental factors and also the young people's reaction to these factors. The messy items include events related to difficult interactions between individuals and also their peers, teachers, and also difficulties around environmental stressors. Different from previous measures that attribute apparent emotionality of students to dysfunction within the students, we are attributing this more to the environment. So higher scores indicated more school-based emotional burden. The work that we've conducted here has been published, and I already put the link of this paper in the chat. So what have we found from this work? So in a survey of 700 involving 735 secondary school students, we found that emotional burden is experienced approximately twice in those with elevated autism and or ADHD traits. So these include people who have diagnosis of autism and or ADHD, but also people who have higher traits in the cutoff of the screening measures. And they experience this twice compared to the neurotypical students. Those with combined ADHD and autism experience this a little bit more, but the differences of the emotional burden among neurodivergent groups were slight and not really significant. You see here that people with ADHD or autism experience similar burden, but in reality, they are both associated, the burden that they experience associated with slightly different triggering events, and we will see that a little bit later on. But what more importantly, oops, I think there's something wrong with the slides here. Okay, more importantly, I'm sorry, apologies. Emotional burden is associated with strongly with depression and anxiety. And emotional burden as a construct and difficulties in regulating emotions so this is a within subject within young persons difficulties are independently predicting depression and anxiety and mental health problems in these young people cross-sectionally. So we haven't, these are just in one time point. And interestingly as well, from our the work that we have, the data that we collected from schools, however, it's not complete yet. There is association between emotional burden and also school attendance and attainment, and this is very, very early findings, and you can see this on the slides here. Not really sure why this slide is a little bit messed up. What we have done as an extra bit of analyses, and this is something that we would like to involve you in. We look into those triggers that is specific for individuals with ADHD and comparing it with the individuals with autism. So I'm going to stop sharing and share a Menti because I'm curious about your experience with students with autism and ADHD yourself. So what do you think are the top triggers for ADHD students in your experience at school? Being accused of something you didn't do, pressure to do well. Great, thank you. Still going. So, but it looks like not being allowed to do things that help you manage your emotion is top triggers in your experience. And being accused something you didn't do is the second. So that's great. So I'm going to ask the same question for autistic students now. What are the top triggers for autistic students in your experience at school? Great. So it looks like chaotic or noisy environment is a top trigger in your experience, and also last minute change of plan. So unpredictability in school environment. Great. So you can still access the Menti, and I'm going to go back to sharing the slides, and we'll have a look at what kind of triggers are more influential in emotional burden of ADHD students or autism. So when we analyze further which upsetting events were differentiating between students with ADHD and those with autism, and this is basically what we found. Students with ADHD told us that experiences with teachers or in situations where they have low stimulation, such as boring lessons and tasks, is something that is triggering for them, and also accused of something that I didn't do is one of those things. You're right. And also for autistic students, those interactions with peers are the one that is most kind of commonly triggering for them, as well as sensory discomfort. So chaotic and noisy environment is among those. So what I wanted to tell you, though, these are a few items that sort of all in a group sort of influencing the differentiation of scores of burdens for each people with the diagnosis. However, in reality, there is so much overlap between the two groups. Especially, I didn't really show you the data from the autism and ADHD combined group, which are sort of middling in between in terms of the experience of emotional burden, specific triggers. When we try to contrast this with neurotypical students as well, there are some items which are specifically more differentiating, and this is due to the neurodevelopmental kind of experience. So peers talking behind my back, sensory discomfort, not understanding others, that's are overlapping with the autism items. autism-specific items, but yeah, it's basically pointing into the large overlap between upsetting events that is affecting all groups of students. So the next thing that we did is we turned our focus to what happens soon after students have experienced the upset feelings. And this is important as how students typically respond after they're upset may have bearings on their mental health or ensuing experiences. So this is the second questionnaire that we created. We designed all of these questionnaires, by the way, are co-produced with young people with neurodivergence. And this is called My Emotional Response in School Inventory, or MERCI. The questionnaire contains 20 items divided into 3 separate domains: outward distress expressions, inward distress expression, and also solution-focused responses. And the items of these questionnaires are as follow. So, for example, for outward distress expression dimension, it involves items like shouting or swearing, or get into a fight, storm off, or hit out or punch objects. Inward distress expression, so items like withdrawing into yourself, shutting everything out, hiding feelings, hurt yourself, not being able to get it out of your mind. Solution-focused responses include rethink things, not blowing things out of proportion, look for support from others, and talk to an adult, and distract yourself by thinking about positive things. So the way we word these items, we try to do it, both the items and the instructions, we try to do it as neutral as possible. There are no good or not so good responses here. We just wanted to know what the students' responses are like, and yeah, and what is the likely response for them. And when we look into the different diagnostic group, interesting pattern emerges. So, for example, in terms of the outward distress expression, all neurodivergent groups showed higher outward distress expression relative to the neurotypical peers. And you can see here, so these are the ADHD and the combined ADHD and autistic students. The outward distress expression is more prominent in these groups, and this is probably something that you relate with your experience at school. Those with ADHD diagnosis typically stand out, and they make themselves heard, and they express their emotions more extrovertly. And what have we found in terms of the inward distress expression? So all neurodivergent groups equally showed higher inward distress expression, or engage in this inward distress expression relative to the neurotypical peers. So this is where the findings is more interesting and sort of challenge a bit of the misconception of, for example, particularly ADHD groups usually being shown as less, being thought as being as showing less feeling inwardly. But they are here, they're as likely as the autistic group to hide their emotion, to withdraw from others by their own admission. In terms of the solution-focused responses, the ADHD groups are demonstrating the lower solution-focused responses compared to other groups, whilst the autistic groups in comparisons are not so different from the neurotypical groups in terms of deploying these kind of solution-focused responses. So those are the interesting finding we have in terms of group differences, but more interestingly, when we combine responses to being upset with emotional burden data, we are improving the prediction of students' mental health difficulties. It explains 48 of the variants in depression and 56% in anxiety scores. And among those domains, inward distress expression, inward distress responses, such as hiding feelings or shutting others out, were the most strongly and specifically linked to higher depression and anxiety cross-sectionally. And this can be really, really challenging for teachers, especially when it comes to supporting students' mental health, because it's those responses after being upset that is not that is less visible, that are really sort of like the ones who need the help the most. So more surprisingly, outward distress expression is not so much associated with mental health problems. It's very, very weakly associated, if you like. And solution-focused response is associated with lower anxiety, but this is only in groups with ADHD, so groups of students with ADHD alone, or those with combined ADHD and autism, who in general have lower responses of this type to begin with. So those are the interesting findings from the quantitative studies that we conducted with 700 students or so. And now Georgia will continue and describe what helps to manage this emotional burden according to students.
We have heard about emotional burden. We have heard about the different ways that it can interact and affect mental health. But what about what helps? So if such emotional burden does exist and does hit harder those who are neurodivergent, what is it that we can do to help people live happier, better lives? We did a piece of work, again, based on young people's preferences and experiences, to understand how we can situate emotion regulation from a neurodivergent, if you like it, perspective, and hear from young people themselves. So we did ask them what helps to prevent experiences from becoming upset that we know that can relate to all that burden. And participants said things that are not really rocket science. Why should they be anyway? So I'm hoping when you will hear this part of the presentation that you will feel inspired, but also validated, because so much of what young people are asking are possible to do, and they rarely relate to spending more money or putting a new program into our curriculum and so on. So very often these things have to do with our culture, with how we think about others, how we interact with others, and so on. Young people wished that others treat them with more kindness, that others support them to feel accepted as they are, to feel that they are enough. And they very much appreciated loyalty in friendships, particularly those with ADHD. They spoke a lot about having healthy experiences of relationships with others that do not challenge them as a core part of staying well. Everybody, but particularly those who were autistic in our sample, spoke about the importance of shared interests, of being allowed to hyper-focus into things that they make them feel valuable, make them feel, good about themselves. So much of what the young people have told us is about connections and acceptance, is about connections and acceptance and relationships over rules, over fixing things and trying to fit in. They said that they feel much more supported when others are having established, predictable, kind relationships, when they feel accepted, when the school environment is operating in a way that supports peers as well, to support other peers and not to bully, rather than when they're given a fidget toy, a sensory toy, or they are told how to fix things. So many participants also spoke about a big need to belong. Nobody wants to be included in a school that they don't feel like they belong. Belonging is reported to reduce emotional intensity. Young people spoke about the times that they feel that they belong, that they're more able to then manage adversities that from time to time in life anyway, in the school life, will come up. To experience belonging, neurodivergent students said that they need others to attend their particular inner experiences, not to look just at their behavior or how weird or not they are acting, but to be appreciated for their sensory, emotional, cognitive differences without judgment or, again, quick fixes. Next. Young people spoke a lot about self-care as a protective practice. Difficult moments will come in human interactions, will come in the school environment, either because of relationships with staff or peers, or because of the pressure of exams and so on. So people said that they really want to have chances proactively, to have quiet time, to read things that they really like, to meditate, to read positive messages from the parents or others who love them, to be able to listen very predictable music playlists, to have sensory resets, to drink water, to breathe, to move, to walk. Lots of them spoke about the importance of having recuperating spaces in the nature in order to not to burn out, and they spoke a lot about creative expression as well. And now when I say creative, don't just think of arts, think of many different multimedia alternative ways of entertaining yourself but also expressing yourself. All young people spoke about the importance of familiarity and how that soothes their sensory system, and sensory calming activities, low arousal classrooms and corridors, quiet and solitary routines as well were very important for some autistic people. Again, here, careful not to be confused. People don't want to be alone. People just want to have space to be, people don't want to be lonely, but people do want from time to time to be alone and to recuperate. Self-care, the way young people described it to us, was rooted in sensory regulation, in meaningful distraction and emotional grounding. Participants not only recognized what worked for them, but also spoke of these routines as essential to navigate daily demands, particularly in environments that often feel unpredictable. And school can feel unpredictable. Your teacher might go off sick, different social situations, can really make things high arousal. So making things predictable, less stimulating, but also not boring and less social challenging can really prevent people from having, that Coca-Cola effect that I was telling you earlier, to be very sad, to feel very low, to feel very angry, to be very aggressive, and so on. Self-care as protective practice has been extremely important, and equally, participants emphasized the need for affirmation and gentle check-ins from others. Being listened to. Young people have told us that many people around them, particularly in the school environment, want to help them, but they rarely listen to them. People want to help me to fix things, but they don't listen to me. Active listening is simple, but it's not easy, I guess, for all of us. Check-ins from trusted adults and trusted peers can feel extremely validating and a nice way to offload and to feel less alone. They spoke about getting that reassurance with people that they can trust, and the emotional validation from sharing, as well as predictability about what happens next. Those with dual diagnosis made more points about affirmation and reassurance, whereas those who were autistic, they spoke a lot about these gentle check-ins and almost like a social contract to know I can come to you and I can trust you and you will check in with me about how is things with me, because I will struggle to initiate. That was pretty common in many cases. Freedom in order to manage better my emotional responses during periods of upset, because it's just impossible to always prevent upset. For many of those who had ADHD diagnosis, it was important to exercise their agency. I want to be given options. I want to initiate options. I don't want to be told what to do. Choosing coping strategies, creating my own coping strategies and others accepting them. Temporary disengagement to cool off, self-initiated problem solving, as I said earlier, and positive distraction are things that are very, very much valued from young people. When it comes to those as well with autism or dual autism and ADHD diagnosis, people spoke again about having options and comforting routines and being kind to self. Instead of just trying to overcome the emotion, they need to be reminded that it's okay to feel this way, but not in a patronizing way, because some young people also felt that people tell them these things without really meaning it, and sometimes they feel it's not validating. They want to be reinforced to think about ways that they can be kind themselves to themselves, and how to build some kind of routines that help them to distract themselves in their preferred ways. In moments of intense emotion, participants describe the short-term benefit of releasing their feelings physically, vocally, so letting it out should not be underestimated. This form of expression, letting it out, whether through crying, steaming, or yelling into a pillow, was reported to provide relief, even if it didn't fully solve the underlying issues. And it's an interesting one, because in this theme and in the previous theme as well, people said pretty much, let me manage it, hold it, be around me and hold me into this situation emotionally without rushing to a solution. And I think that's a quite important thing, because our cultures very often reinforce this kind of fixing and fix and solution and have a toolkit and so on. Leveraging own strengths. I think one of the topics that surprised me, if you like it, during the analysis is reading from young people how much they said that I can be more prepared to prevent upsetting experiences or to manage upsetting experiences when others around me support me to leverage my own strengths. I have solutions, I have answers, but I don't always know how to access them. And also, I need others to believe me that I can draw strength from within. I'm not just a bunch of deficits. I have answers, I have ideas, I have my own coping strategies. And I think that's a very important message for all of us. Young people said that I want to experience a sense of achievement. I want to be reminded that I'm good enough, that I'm worthy, to have items around me and notes that remind me that I'm someone who is worthy, who is strong, who matters. Also, they said that they would like help and kind tools to self-reflect, not during an episode that is very upsetting, but proactively and reactively only after they have recuperated. Help me to join the dots, help me to make sense, help me to understand my personal journey and how my feelings fit into that, and what I can do differently next time to protect myself or others into that situation. So they do ask for reflective practice, and they want to be engaged into that, not to just be told what to do. I spoke about experience of achievement, and building a positive self-image has been extremely important for them. And also, anything that that can support them to rehearse a plan and own it, feel that it's their own plan. I just want to say a very big thanks, because obviously behind this massive piece of work, and there's many people, many colleagues, Edmund, Susie, Sylvan, Emily, Jane, Myrtos, so lots of credits to all of our fantastic colleagues, but also to the youth co-researchers, because it would be impossible to manage and do things differently and conceptualize things in an experience-sensitive way if we didn't co-produce research. We asked young people to be on board, to come to management meetings, to co-produce methods, to co-produce surveys, to co-produce all the different ways that we have been thinking and working at Restar. Thank you.
Thank you so much, Steve and Georgia.